You're listening to The Drive Home.
Howdy, guys. It's 4:30 on The Drive Home for Tuesday. Wayne, Tanya, and Brian all here.
Indeed.
And we're very pleased to have an esteemed guest join us once again to talk about things happening in the world, and that would be Dr. Ryan Jennings, the Chief Medical Officer of St. Anthony's Memorial Hospital. How are you this afternoon, sir?
Hey, I'm great. I heard you talking about snow. I'm opposed.
You're opposed to snow.
No,
right.
I'm not opposed to snow.
You can have it.
Okay.
Yes.
All right.
I don't mind snowfall like once a year, like right around Christmas when everybody's going to be inside and it's gone the next day and 65.
Really?
Right on.
Well,
Smart move.
that's no fun.
But, Doctor, you join us this afternoon to talk about a lot of stuff because a lot of things are happening. Obviously, COVID-19 has been the big story in your profession now for quite some time. Fewer cases today, fewer positive cases in Illinois today, 7,359 cases along with 117 additional deaths. And that includes some local deaths as well because we're starting to see, unfortunately, a lot more of that around here.
We are, but you raise a great point, and that is that, overall we were extremely pleased to see kind of the post-Thanksgiving now that we're, 15 days, a little bit more than that, and didn't have an enormous surge. So hopefully that's reflective of folks taking good advice to be careful around the holidays, to continue to do your distancing, masking, hand washing, all of those critical elements, because really coming into this, I was extremely worried that, things are busy, but I was really worried. And thankfully, it seems that things have gone fairly stable even immediately post-holiday.
Do you think we've gotten lucky? Because, I'll be honest with you. Not to rain on your parade there, but I went into a big box store the other day, and I'll bet 30% of people had masks on. And if you were under 25, nobody had a mask on.
I think there's a component of luck, for sure, but I also know that the folks that where you start hearing about a lot of it and the hospital burden and things like that are usually older folks, or folks with other problems. And so although, the younger folks tend to be the spreaders type thing, hopefully being able to keep them distanced and things like that is helpful. But it sure would be nice to see, no matter what your age, making sure that you're masked in public and being cautious because you can hurt someone else.
All right, so I got to lay this on you real quick. Tanya's got a question waiting in the wings here, but I got to ask you this real fast. So a lot of things that we've been seeing on our social media and I've seen online in general have been, and I know you've talked about comorbidities a lot when we've had you on the air before, and that's not an uncommon thing at all. But one of the things that I've been seeing a lot lately, especially from younger users, are they constantly ask, okay, we had 2 deaths in Effingham County. How old were they? And 2, what else was wrong with them? But I don't understand why we're in this vein, especially it seems like with younger folks where, we care so much about the beginning of life. Why can't we have a little bit more care for those at the end as well?
Well, I think you said it, perfectly. And reality is it's rare to find anybody in an older generation of folks that doesn't have some comorbidity that becomes relevant in the COVID population because almost everything has relevance. And it's tough to get to 60 and 70 and 80 years old and be perfectly healthy. So you're always going to have comorbidities in an elderly population, but that doesn't mean you should disregard safety when you're around those folks, because although minor, hopefully for most younger folks, very dangerous for older folks.
That's very true.
It is very true. Now, right now, how's the hospital equipped to handle the COVID cases? Do we still have, a lot of beds available? And what about the ventilators, the PPE for workers and stuff like that?
We're so fortunate because of having access, even across the region to multiple hospitals, and the collaboration amongst all hospitals has just been amazing. And with that comes supply chain benefits. So when you need access to additional PPE, that becomes available. Or when there are a need for ventilators in a certain location, they can be moved there. So access has really been well preserved, and there has been obviously the need from time to time to transport people, but we transferred people to tertiary care and things like that periodically long before COVID came around. So the process that we have in place to make sure that we're always ready, that we always have capability and capacity to manage it has actually preserved incredibly well throughout this. So knock on wood, if the post-holiday of Christmas and New Year's doesn't have any major hiccups compared to what we saw with Thanksgiving, and then hopefully things start to tame down post-vaccination timing and those types of things, we'll start to see some gradual improvement, and that burden will be lifted. Honestly, the one thing that we ran a little low on are extra large of a particular kind of gloves, and we have other options, So the good news is that even when there's been one thing a little bit low, there's an alternative, and really has been just incredible to see the orchestration of the supply centers and the national supply chain. I mean, it's impressive to see the scale of the work being done to make sure that when things are needed, they're brought to where they need to be.
So you're saying we got a bunch of big-handed surgeons at St. Anthony?
You knew he was going to say that.
They need full coverage. Full coverage.
That'll be the next big story.
That's right.
Yeah,
I'm a little envious.
Dr. Jennings, most of us actually here at the radio station have gone through the COVID testing procedures
and symptoms
and symptoms and sometimes multiple tests and stuff. So most of us here at the station are aware of, there's multiple options for getting COVID testing. But someone else had asked a question, when someone comes to St. Anthony's Hospital, how do you determine whether they might have COVID? I think someone was kind of just curious about that.
So there are a couple options, and actually that's one area where we've seen improvement. We've had new additional platforms come online, and some of the more rapid testing come online. So there has been a difference. Now, the difference between the what we call the antigen testing, the test that's just kind of a swab that's not the one that goes way back in the back, that kind of runs right there in 15 minutes basically. Those are really good in people that are symptomatic in the first 4 or 5 days or so. After that, they're not terribly accurate, and they're not very good at all for somebody with no symptoms. So they're really designed to be in somebody where you have a pretty high suspicion that that's what they have. And in that scenario, if they're positive, they're undoubtedly positive. If they're negative, there's still a small chance that that they are positive, and they need then the PCR test, which is the one that we do that kind of goes back a little further and takes a little bit more time to run, but is the so-called gold standard. That's the one that when it's positive or negative, that's the one that we really count on. So the docs actually kind of weigh their options. The other things that we see are there's more and more combination tests coming out. So being able to test somebody for influenza, for COVID, and for things like RSV, all with one swab, which then can accomplish a lot, because one, it could give me an alternative diagnosis and be able to say, well, great news, you don't have COVID, bad news, you got flu. And there we have some options for treatment, still as well. So the tools around testing have gotten considerably better. We've collaborated with the public health departments around that as well to increase the number of the antigen testing, which again is really useful in somebody with symptoms just right at the onset in the first 4 or 5 days or so. So it's a little bit of how long have you had it? Are you sick? And if you're just doing surveillance testing, when we first started this, then the public health departments especially were just doing kind of mass testing to kind of find out how much is out in the community. That antigen testing is not very effective for that. That's when you need the PCR type testing.
Gotcha. Now, with the vaccine being, released yesterday, and Effingham County obviously is not one of the top 50 Illinois counties as far as death rate per capita, do you have any idea when we might see the vaccine here in Effingham County or even at HSHS St. Anthony's?
Not yet. We refer to the public health departments just like you do. It is an incredible undertaking to start the distribution. But, we're still focusing to make sure that we get our medical staff, our nursing staff, the people that are, in the closest contact, access to vaccine as soon as it can possibly be that way, be able to be accomplished. And even that's quite an orchestration. So it's another one of these things that's just kind of mind-blowing when you see the national effort to move this vaccine around and get it as quickly as possible, and especially this one that presently is being rolled out that has all the stipulations around keeping it ultra cold and those types of things. So exciting to see it coming, but a definite timeline we don't know. And of course, it's always piecemeal to understand, how many doses any one area is going to get. And their formula for determining that. I mean, I told the medical staff, the good news is that, we had a very low mortality rate in Effingham County. The bad news is when it comes to vaccine, we had too low of a mortality rate in Effingham County.
Right, right.
That's true.
It's really great that we didn't get a bunch of vaccine on one hand. On the other hand, it sure would be nice to start the process of getting at least those healthcare workers and long-term care residents vaccinated as soon as possible.
Absolutely.
Well, we had another question that came in, which I hadn't remembered, and then I was like, yeah, this was a question we had a while back, and maybe it applies a little bit more now. Someone was wondering, do you wear a mask after you've had COVID? What do you say when someone asks you that?
That's a great question.
Well, and it comes up again now around the vaccine. And, how soon will we be able to come out of our masks? And the real answer to that is when we see a true downturn in the number of public cases for both of those, really. Now, there is presumed immunity with the having had the disease for at least 90 days, and that's part of the thought around when should you vaccinate if you've had COVID. So for myself, when the vaccine becomes available right now, I've had COVID within the last 90 days, so it doesn't make sense for me to get it and deprive someone that maybe doesn't have immunity already intact.
Right.
But for the foreseeable future, masking will be a reality. And, the golden 90 days where theoretically you can't catch it is still kind of theoretical. And once you're vaccinated, there's a 5 to 10% of people that don't become immune after the vaccine, so they're still at risk. And of course, we just don't know enough yet. Even though it's that we're getting some information every single day, to be able to say, hey, we're going to be ready to take our mask off is probably not any time in the immediate future. If it happens in 21, I think we'll be all celebrating that day.
Yeah.
Yes,
Agreed,
we will,
100%.
for sure.
Doc, a whole lot of us here went through this at the radio station, myself included. Brian Dust did. My wife did. A lot of us did here at the station. I have to say, what's been weird for me is I'm still having weird symptoms now. Tomorrow will be 2 weeks out of quarantine for me. And I'm like Sunday evening, I felt like I had it all over again. And then woke up the next morning on Monday, felt fine. Still can't smell anything. Brian, can you?
Yes. But taste is off. It's not
my
gone.
smell is gone, but my taste is weird. It's just the symptoms are strange.
Yeah.
And the residual is strange. Yeah, I mean, you're exactly right. My taste and smell stayed gone for several weeks, and then intermittent, just profound fatigue, that type of thing seems to be part of it. And really, where we're seeing that impact is slow recovery, and people that get it significantly end up hospitalized. Man, they don't just pop out of the hospital like they had their appendix out and they're ready to go ride a bike. I mean, they are wiped, and so we're seeing a lot more need for additional long-term care placement. Just for therapy and recovery. A lot more utilization of what we call swing beds, which are basically rehabilitation beds within hospitals to just to get them back on their feet, and it's just remarkable the weakness and the fatigue that goes with it, even if their actual acute disease didn't really last that long. I mean, you get the flu, you're down 3, 4, 5 days, and you kind of start to bounce back, and life goes on. This has not been like that. I mean, even with people that maybe only were down for 4 or 5 days, they're having residual complaints of fatigue. Persistent headaches is not unusual at all. The taste and smell definitely takes quite some time to come back in many people. And of course, we're just learning more and more about some of the long-term complications that they've seen in children. with this inflammatory response syndrome and those types of things. So there's just a lot we don't know, and it just reinforces the idea that this is not a benign illness by any means. The consequences have been felt way beyond just the initial acute phase of the illness. You either make it through or you don't type thing. But my gosh, there are people that stay incredibly sick for a long time.
Yeah. Well, Doc, as always, we are so glad to have you on. We could talk to you for a lot longer, and I wish we had more time because there's a lot of stuff we could delve into. Hopefully we get to talk to you again soon. But thank you, as always, for the wealth of information.
Hey, my pleasure. And, hey, remember, coming up on the holiday, keep up the good behaviors. Let's not have a surge like we did, like we thought we might have. And when the vaccine rolls out to the public, that's going to be part of our long-term solution.
Very good.
Right
well
on.
said.
Sounds good.
All right, Doc, as always, you stay safe. We appreciate all the work you do, you and your staff, because the hospital folks have been working really hard.
Yep.
Oh, they're amazing. They're amazing. Thank you so much, guys, and have a great week and a great holiday.
You
there
too.
you go. You as well, Doc. Thank you. There's Dr. Ryan Jennings, Chief Medical Officer at HSHS St. Anthony's Memorial Hospital. Very pleased to have him on the air once again.
Always good.
Absolutely. Yes.
Always good.
Absolutely. Yes.
Always good.
Absolutely.